Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 4 of our course in patient and staff education. And in week number 3, our primary focus was on theories of leadership and concept of leadership, and also quite a bit of discussion along those same lines, talking about change and change theory. And this is really important and very pertinent for a staff educator or anybody in patient education, because if there's one consistent thread that virtually all staff educators have, it is that in our organizations, we are the ones that are usually implementing change. It is usually the educator that is given the responsibility of taking a new regulation, taking a new practice, whatever it is that the change involves regarding some aspect of practice. It is usually laid in the lap of the educator, and then the educator has to see about making it work. And so that means that, as I've been saying through the class, we are nurse leaders. That is something that is very important to understand. Is we have to understand that we are people that are, not just implementing change. We also have to be leaders because we have to be viewed as staff as people that they can look up to and trust. For the changes that are being implemented. And quite often we're the conduit between the faculty and between administration. It's a very common relationship that we have. And so we have to wear a lot of hats. And so understanding leadership is important because there's different types of leadership. And this is something that isn't new or shouldn't be new. You've had leadership courses before. In very general terms, there's two general types of leadership. The first is transformational leadership, which is kind of at the higher tier. And if you look at the Institute of Medicine report, really the call for the Institute of Medicine, the IOM report, is to call for nurses to be transformative and to be transformative leaders. That means transformative with our staff and transformative with patients as well. We should be looking to help to actually change things. A transactional leader is another type of leader that is more commonly seen in managers. Transactional leaders are the people that sort of do the day-to-day work of hospital administration, where the transformation leaders are the ones that are actually leading and guiding change and actually helping to make for real changes and outcomes. Both types of leaderships are actually important. Every good transformation leader also either has to have a good transformational person underneath them. When I've been, for example, a director, I've always relied on the secretary underneath me or the program director underneath me, who is actually doing the spreadsheets and doing, a lot of the paperwork, getting all that stuff done, keeping things organized. That's an important part of leadership as well. And it's an important part of what we do because everything that we do needs to be documented, and there's always a lot of paperwork that needs to be done. And so having somebody that can do that is important if you have the luxury of working with an organization where that can take place. But quite frankly, usually most of it's us in our education offices and the filing cabinets we have, or nowadays the filing cabinets we have in our computers, that track all the information that we need for various accreditation regulatory agencies. So once again, a very good discussion. One thing in your feedback in week number 2 was in a conference call with the school this week and with staff. One of the criteria that was discussed was writing skills in APA, and so it was reinforced to we instructors was to be good and be consistent in our feedback in APA and in writing. This is something that, quite honestly, I generally haven't given a lot of focus to as much in the past, but to be consistent with the other instructors and to be consistent with the program and with our program outcomes, particularly for this particular class because of the courses that you have coming up where writing is an important consideration. I'll be getting a little bit more feedback in your grading as to your APA and to your writing skills. So that's not because I'm trying to be ticky-tack or because I'm trying to, look for ways of trying to bring people's grades down or anything like that. Far from it. As a matter of fact, I don't think anybody's grades will necessarily be changing too much, but my feedback will be geared more towards helping you to build those writing skills. That is important. Being a good communicator is important in leadership, and so it's very consistent to go ahead and be giving you feedback on your writing skills through the program. Week number 4, we shift our focus a little bit, and we're going to be talking now, moving out of the staff educator role and talking more about patient education this week. So we're going to be talking about literacy, and this is an important consideration because, well, as nurse educators, we're usually the experts. We're the people that know, we understand, we know all the lingo, we know it right out of the textbook. We're really the best people to be able to teach the concepts that we know and all those things that we know about health and wellness and even medicine, all those things we teach. However, we're teaching to a patient population that varies widely, and many of them have a well, if they've never been to college, if they've never been to school, if they've never learned to even read and write, how do you teach somebody? And so understanding literacy is important. And so the discussion question this week, you're going to have a discussion post where you are given a health literacy scenario, and you have to address how you would be how would you adapt the information that this patient needs, given the limitations that this patient may have? In other words, how do you take sometimes very complex information and boil it down into layman's terms so a patient can understand it? It's very important. Patients need to understand about their medicines and about their health care. But taking that information and putting it in layman's terms is sometimes a tricky deal. And so we're going to talk about that. We'll be talking about that for the next couple of weeks and in your upcoming assignments as well, as to how to make sure that we're meeting the diverse literacy needs of our patient population. And so with that, your paper that you're turned in this week, your leadership in your scenario, I will be grading those throughout the week. I'll start grading those probably on Wednesday and probably have them all done, I'm guessing by Saturday. So kind of be looking for it. I'll be grading a few of you each day. It takes me a little bit of time to grade those, especially with uh, the writing feedback that is required. Anytime we have to grade a paper, of course, it's a bit time consuming, but look for the feedback no later than the weekend. Most of you will probably have it back by Friday, and I should have the discussion questions also graded by either Wednesday or Thursday as well. So once again, I look forward to participating right along with you in the discussion questions. My style for this class has been to be giving a little bit more detailed or kind of long-winded responses in fewer threads. So I haven't been giving responses in each of the threads. And that's because I've been trying to give feedback that is more summative, but more meaningful as well. So be looking for my feedback in the various threads. I would encourage you to review everybody's, the reviews, review all the feedback from all the class, and I'll probably get to about 50 to 75% of you this week for this particular week's discussion question. But I look forward to participating along with you, answering your questions. If you have them, please feel free to answer or ask them, and I will answer them as soon as I can. And I look forward to seeing you in discussion forums.